Hi there, Peter Axon here, and this is a special edition of this week's CEO blog. So I'd like to talk a little bit today about COVID-19 and the work that we've been doing within the organisation to help prepare for what may come over the next few weeks and months. So firstly, and most importantly, I'd like to say a huge thank you to all of the teams and individuals out there that have already been working incredibly hard, going beyond the call of duty to support individuals and the organisation more generally to prepare for the situation. So a huge thank you to you all for your work to date. I'd like to talk a little bit about what we've been doing so far in preparation for the situation, and secondly, I'd like to specifically cover a few points around how we are supporting you as individuals, our staff across the organisation, both now and in coming weeks. So firstly, a little bit about the preparations that we have in place. So hopefully many of you will have read the detail that we are providing via CAT, our intranet system. We are keeping that as up to date as we possibly can. Information is coming in pretty rapidly, as you can imagine, and as the position changes nationally and regionally, we are taking that information and, as I said, updating the CAT system on a regular basis. Secondly, Jonathan O'Brien, our Director of Operations, is providing regular briefings on the situation that, again, hopefully are of value to you all. Thirdly, we have an incident room set up within the Harplands site that is ensuring that we cover all things that we need to in relation to the situation, whether it be emergency preparedness around protective equipment for our staff, all the way through to purchasing of more standard equipment that we may need throughout coming weeks and months. So that incident facility is a really important one, and I'm really pleased to say is overseeing the situation in a really healthy, effective manner. So next, I'd like to talk a little bit about yourselves, how we're supporting yourselves both now and over coming weeks and months. So there's four areas that I'd like to touch on. First three categories are firstly where you or a close relative, i.e. somebody that you live with, you feel you may have symptoms associated with COVID-19. In those instances, there is a very clear process to what we call self-isolate. So please do read the guidance to understand what those symptoms are, and in those circumstances, please initially consult with your line manager about that process for self-isolation. The second category relates to where you may have an underlying health condition that could impact the significance of the virus should you contract it. There's very clear national guidance from Public Health England to describe what those underlying conditions are. Some are what we would call low risk issues, and others are higher risk. We'll provide through this video and a link very clear information in relation to what those underlying conditions are, both in terms of low risk and higher risk areas. Again, should you realise that you have one of those underlying conditions, in the first instance, please have a conversation with your line manager. So the third category relates to situations where you may be impacted by the virus's spread but don't have the virus or symptoms associated with it. So an example would be where your childcare arrangements are impacted by the virus's spread. So that and other similar circumstances can absolutely be supported by the organisation, and we've got a variety of policies, whether it be flexible working policy or other policies, to support you under those circumstances. Again, I would say the first port of call is to have a conversation with your line manager should you be faced with those circumstances, and I would sincerely hope that various policies would enable us to support you to continue to work. Perhaps not within the organisation, perhaps within different premises, perhaps your home, but would enable you to continue to effectively work. So on to the fourth category. Now this category relates to the national principle of minimising risk to each and every one. And to enable that, what we have developed is a set of criteria that define whether any of one of our staff is essential or non-essential. Those that are deemed non-essential, we are going to ask to work from home, which will reduce the level of risk to those people, but ensure the maximum ability to deliver and continue to deliver effective services for our population. Now, please don't get hung up on the term essential and non-essential. To me, every member of the organisation is absolutely 100% essential. There's a very specific set of criteria that we apply in business continuity terms that will define whether people are essential or not essential, and it's that set of criteria that we're referring to here. Now, within emergency planning arrangements, this classification is often used, very clearly defined, and there for good reason. And what we've decided to do as a board, as an organisation at Combined, is to enact those emergency planning arrangements. So over the next couple of days, I've asked service leads to assess each individual and teams that operate across the organisation to understand what category individuals and teams fit into. Are they essential workers or non-essential workers? Now, the basic definition of an essential worker is that were they to not be working within the organisation, within their normal place of work, that would potentially impact on service provision, clinical service provision, and business continuity of the organisation. So clinical service provision is pretty clear. So just to explain business continuity for a second, for example, that could relate to our payroll services, our ability to pay each and every one of us on a weekly or monthly basis. It could also relate to our ability to purchase protective equipment for our staff. So those essential workers that I'm referring to there aren't necessarily only individuals that are frontline staff. So as I mentioned, we're going through an exercise over the next couple of days to ensure that our service managers fully understand the split between essential and non-essential staff across the organisation. And we hope and expect by close of play this Friday, we will be able to describe to ourselves and to define and therefore to make decisions in relation to who is non-essential, and therefore we have the ability to ask to work from home, and those that are essential that we would ask to continue to operate in their normal place of work. Those are the four key areas that I'd like to describe today. My promise to you is that I, the executive team and the whole of the senior team across Combined are working incredibly hard to support you across your various clinical and non-clinical roles. We will absolutely make sure that information as it becomes available at a national level, at a regional level, becomes immediately available to you all, and we interpret that in the most effective way that we can for Combined Healthcare. thank you once again for all of your support so far and hard work, and thank you for your commitment over coming weeks and months. I'm sure together we'll get through these quite extraordinary times, and I'll speak to you all very soon. Thank you.